We are back right now at 4, and Breast Cancer Awareness Month may be over. That's October, but the importance of getting screened does not end with the month of October. Something you should always be thinking about. Dr. Randy Miles with Denver Health joining us today in studio. Thanks for being here.
Oh, my pleasure.
Yeah, so let's talk about mammograms exactly. Can you explain what is it?
Sure. A mammogram is simply a low-dose X-ray of the breast. It allows us as breast imagers to evaluate to see whether there's breast cancer or any other abnormality that may have developed within the breast tissue.
And I know there's a lot of questions, guidelines change. How often should people get mammograms, and at what age should you start getting them?
Sure, there are different guidelines that guide when a woman should start screening mammography. I would say really talk to your doctor about what works best for you, because there are certain women who are at increased risk who may need to start breast cancer screening earlier. In terms of the American College of Radiology, they recommend that breast screening starts at age 40 and that you receive that yearly.
Okay, so it's an annual thing that you should get at least starting at age 40, but that could vary based on your family history. So let's talk about the screening process. What does that look like, and can you explain how long it'll take for some people?
Sure. Screening mammograms, they're usually very short exams. Usually we allot out about 15 minutes for the exam. When you actually come in, we compress the breast for a short period of time. So there may be a little discomfort there, but not too much, just so that we can limit the motion of the breast, so we can get a more accurate depiction of what's going on in the breast tissue. But very short exam, minimal discomfort, and it's something that I always like to say, like, this short exam could potentially save your life.
And that leads me to my next question. Early detection is always key. So how important is it to get these screenings?
Sure. So if we catch breast cancer early, while it's small, before it spreads to other parts of the body, 5-year survival approaches 100%. So it's so important for you to continue to screen the breast. So if there is something there, we catch it early, and like I said, it could save your life. So.
And we were just talking before we came to air, you have been super busy the month of October. Now
Definitely.
that it's over, biggest awareness is in October. What is the biggest misconception about breast cancer out there?
I think the biggest misconception is that this doesn't occur in men, and that's why we want women to definitely pursue screening and to receive their annual screening mammograms. But for men, if there are any concerning symptoms in the chest or around the nipple area, we want you to be vigilant about letting your doctor know. And those things that you want to look out for are any lumps or any nipple discharge. Let your doctor know, because they can send you into the breast imaging center so that we can evaluate.
Bottom line, you should always be communicating with your doctor about this all the time.
Yeah, definitely.
Dr. Randy Miles with Denver Health, thank you for being here.